Imagine waking up one day and realizing that your strength has quietly slipped away. No, it's not just about feeling a little weaker than you used to. It's something far more insidious. For seniors, muscle loss isn't just a minor inconvenience. It's a life-changing issue that affects independence, mobility, and overall quality of life. In fact, by the time you reach 70, you could have lost up to 40% of your muscle mass, often without even realizing it. The shocking truth? This gradual decline starts much earlier than most people think, and it's happening in your body right now. This issue, known as sarcopenia, affects millions of seniors worldwide. Research from the National Institute on Aging reveals that those who experience significant muscle loss face a 320% increased risk of developing mobility disabilities, such as the inability to walk without assistance or even use a wheelchair. This isn't just an inconvenience. It's a condition that could lead to a dramatic shift in your ability to live independently. But here's the good news. There's a vitamin, one that you might be overlooking right now, that has the power to reverse muscle loss and help you maintain your strength as you age. This often forgotten nutrient plays a key role in muscle recovery, strength, and mobility. And the best part? It's something that can be easily incorporated into your daily routine. Curious? Stay with us, because we're about to reveal the vitamin that could change everything for your muscle health. If you're new here, welcome. We're so excited to have you with us on this health journey. Before we get into the details, don't forget to hit that like button and subscribe to our channel so you won't miss out on more amazing tips to improve your health. We'd also love to hear from you. Drop a comment below and let us know where you're watching from. Let's connect and grow together as we share more life-changing health tips with our amazing community. As we age, our bodies undergo various changes. One of the most significant and often overlooked transformations is the gradual loss of muscle mass and strength. This condition, known as sarcopenia, typically begins in our 30s but accelerates after the age of 60. Sarcopenia isn't just about losing muscle size. It's a multifaceted process that involves a reduction in the quality of muscle fibers, a decrease in muscle strength, and a decline in the body's ability to regenerate muscle tissue. The result is a diminished ability to perform basic tasks that were once effortless. What's worse is that this muscle loss tends to happen so slowly that it often goes unnoticed until it becomes a serious problem. The consequences of muscle loss can be devastating. At its core, losing muscle mass means losing strength, endurance, and balance. Simple activities like climbing stairs, carrying groceries, or even getting up from a chair can become increasingly difficult. For many seniors, this can lead to a heightened fear of falling or injury, which only exacerbates the problem. In fact, studies have shown that muscle loss in seniors can lead to a reduced ability to perform activities of daily living, increasing dependency on caregivers or family members. Beyond the physical effects, there's also a significant emotional toll. Losing independence can affect mental well-being, leading to feelings of frustration, helplessness, or even depression. Seniors may feel like they're losing control over their own lives, and this can lead to social isolation as they withdraw from activities they once enjoyed. The impact of muscle loss goes far beyond inconvenience. Research underscores the serious consequences sarcopenia has on seniors' overall health. A study conducted by the Johns Hopkins University revealed a staggering statistic. Seniors who experience significant muscle loss are 320% more likely to develop mobility disabilities than those who maintain healthy muscle mass. This means that the risk of being unable to walk unaided, or even needing assistance for basic mobility tasks, increases drastically with muscle decline. Further studies show that the loss of muscle mass is directly linked to an increase in falls, one of the leading causes of injury and hospitalization in older adults. A study published in the Journal of the American Geriatric Society found that seniors with muscle weakness are twice as likely to fall compared to their stronger peers. These falls often lead to broken bones, hospitalization, and in some cases, long-term loss of independence. In addition to the risk of falls, muscle loss also increases the likelihood of chronic conditions such as heart disease, diabetes, and arthritis. This is because muscles play a crucial role in maintaining metabolic health, regulating blood sugar, and supporting joint function. As muscle mass declines, these conditions become harder to manage, creating a vicious cycle of decline. One of the biggest misconceptions surrounding muscle loss is the belief that it's simply a natural part of getting older. Many people assume that a gradual decline in muscle strength is inevitable, thinking it's just something everyone experiences with age. This misunderstanding often leads to a lack of urgency in addressing the issue. The truth is, while muscle loss does become more pronounced as we age, it's not something we have to just accept. Sarcopenia is preventable and reversible, especially when caught early. Too often, muscle loss is dismissed as just part of aging, which allows the problem to quietly worsen over time. Another critical issue is that many medical professionals overlook the role of vitamin deficiencies in accelerating muscle decline. While most doctors are quick to address conditions like arthritis, osteoporosis, or cardiovascular disease in older patients, they may fail to recognize how deficiencies in certain vitamins and nutrients, particularly those essential for muscle health, are contributing to the problem. For instance, vitamins like D, B12, and D3 are crucial for maintaining muscle function, yet many seniors are not tested or diagnosed for these deficiencies. Research indicates that a lack of vitamin D or B12 can significantly speed up muscle deterioration, but this is often overlooked during routine checkups. Without adequate vitamin intake, muscle recovery and strength are compromised, and the body's ability to regenerate muscle tissue diminishes. This means that while seniors might be receiving treatment for other age-related ailments, the root cause of their muscle decline, vitamin deficiencies, remains unaddressed. The good news is, there's a vital vitamin that can help slow down and even reverse muscle loss: vitamin D. While it's commonly known for its role in bone health, recent research has shown that vitamin D is equally crucial for maintaining muscle strength and function, especially as we age. This powerful nutrient has a direct impact on the muscles, ensuring they function optimally and can recover from wear and tear. The best part? You can support your muscles with vitamin D through simple lifestyle changes and supplementation. Vitamin D helps muscles in several key ways. First, it enhances muscle strength by facilitating calcium absorption, which is vital for effective muscle contraction. Without sufficient vitamin D, muscles struggle to utilize calcium properly, which leads to weakness and poor coordination. Moreover, vitamin D promotes muscle repair by stimulating the production of proteins that help rebuild muscle fibers after they've been damaged, keeping them strong and functional. Essentially, vitamin D supports the maintenance of muscle tissue, ensuring that the body has the resources it needs to regenerate muscle fibers and preserve strength. Additionally, vitamin D plays a role in enhancing muscle endurance, helping seniors maintain their ability to perform everyday activities like climbing stairs, walking, and lifting objects, activities that often become more challenging with muscle loss. However, despite its importance, vitamin D deficiency is alarmingly common among seniors. Research shows that over 40% of older adults are deficient in vitamin D, which directly contributes to weakened muscles and increased frailty. This deficiency is especially prevalent in those who have limited sun exposure or live in regions with long winters. Studies indicate that seniors with low vitamin D levels have weaker muscles, less balance, and an increased risk of falls and fractures. Furthermore, a study published in the Journal of Clinical Endocrinology and Metabolism found that seniors with optimal vitamin D levels experienced a 20% reduction in falls compared to those who were deficient. This highlights just how crucial maintaining proper vitamin D levels is for muscle health and preventing injury. While vitamin D is crucial for muscle health, it's not the only nutrient that plays a role in preserving muscle mass as we age. A balanced intake of several other vitamins and minerals is equally important for maintaining muscle strength and function. These nutrients work together synergistically to slow down or even reverse the effects of muscle loss, ensuring that your body has the necessary tools for muscle repair, energy production, and overall muscle maintenance. 1. CoQ10, coenzyme Q10. This antioxidant compound helps generate energy in muscle cells by supporting the mitochondria, the tiny powerhouses in your cells. As you age, your CoQ10 levels naturally decrease, which can lead to muscle fatigue and weakness. Supplementing with CoQ10 can help restore energy production, boosting muscle strength and endurance. 2. Vitamin D. As mentioned earlier, vitamin D supports muscle function by helping muscles use calcium effectively for contraction. It also plays a key role in muscle repair and maintenance, helping to reduce the risk of falls and fractures in seniors. 3. Vitamin B12. This vitamin is essential for nerve function and muscle health. Vitamin B12 aids in the production of red blood cells, which are needed to carry oxygen to muscles. A deficiency in B12 can lead to muscle weakness and poor coordination. 4. Vitamin C. Often recognized for its role in immune function, vitamin C is also crucial for muscle health. It promotes collagen synthesis, which is essential for muscle structure and repair. Additionally, vitamin C is a powerful antioxidant that helps protect muscle tissue from oxidative damage, slowing the aging process of muscle fibers. 5. Magnesium. This mineral is key to muscle relaxation and contraction. Magnesium supports the proper function of enzymes involved in energy production within muscles. A deficiency in magnesium can lead to cramps, spasms, and overall muscle fatigue. 6. Creatine. Known for its use in bodybuilding, creatine is a compound that helps muscles produce energy during high-intensity activities. It also boosts the growth of muscle cells, making it a vital nutrient for preserving muscle mass as you age. CoQ10 works at the cellular level, supporting the mitochondria and energy production. As muscle cells lose energy over time, CoQ10 supplementation can help restore cellular energy and reduce muscle fatigue. Vitamin D helps regulate calcium levels in the blood, ensuring that muscles can contract properly. Without it, muscles struggle to function effectively, leading to weakness and a higher risk of injury. Vitamin B12 is essential for nerve health, and its deficiency leads to impaired communication between the brain and muscles. This disruption can result in muscle atrophy and loss of coordination. Vitamin C is integral to collagen production, which helps maintain the structural integrity of muscles and connective tissues. It also fights free radicals that damage muscle fibers, reducing the aging process. Magnesium aids in muscle relaxation by acting as a natural calcium blocker. When magnesium levels are low, muscles may remain partially contracted, leading to cramps and fatigue. Creatine helps muscles regenerate ATP, the primary energy source used during physical activity. By increasing ATP production, creatine allows seniors to perform everyday tasks more efficiently and maintain strength. Among the many nutrients essential for maintaining muscle health, vitamin D stands out as the most crucial for seniors. Often overshadowed by its well-known role in bone health, vitamin D is a powerful muscle-strengthening vitamin that plays a pivotal role in maintaining muscle mass and preventing muscle loss. This vitamin helps regulate calcium levels in your muscles, which is vital for proper muscle contraction and function. Without adequate vitamin D, muscles struggle to use calcium effectively, leading to weakness, fatigue, and an increased risk of falls. Clinical studies consistently show that vitamin D supplementation can reverse muscle weakness and slow the progression of sarcopenia, age-related muscle loss. One study published in the Journal of Clinical Endocrinology and Metabolism found that older adults who supplemented with vitamin D experienced significant improvements in muscle function, including 20% fewer falls compared to those with low vitamin D levels. Another study from the American Journal of Clinical Nutrition revealed that seniors with optimal vitamin D levels showed greater muscle strength and coordination, which helped them perform daily activities with more ease and less fatigue. These findings highlight how maintaining proper vitamin D levels can effectively combat muscle loss and improve overall strength in seniors. For seniors, the loss of muscle strength often leads to a decline in the ability to perform basic activities, which can impact independence. This is where vitamin D becomes a game changer. By supporting muscle function and enhancing calcium absorption, vitamin D improves muscle strength, making it easier to carry out tasks like walking, climbing stairs, and even carrying groceries. For example, climbing stairs, which can become a struggle as muscle mass decreases, becomes easier and safer with adequate vitamin D. Studies have shown that seniors with sufficient vitamin D levels experience improved balance and muscle coordination, reducing their risk of falls while performing such activities. Additionally, vitamin D helps with the strength needed to lift and carry objects, alleviating the strain often felt when performing everyday tasks. In short, this essential vitamin not only helps preserve muscle function but also improves overall mobility and independence, empowering seniors to maintain their active lifestyle for longer. Are you enjoying this video and finding it helpful? If so, please take a moment to comment, like, and share it with others who may benefit from this important information. Don't forget to subscribe to the channel to support us and help others discover the valuable content we provide. Your engagement helps us continue to create more informative videos for you and the community. Thank you for your support. Vitamin D is naturally found in certain foods, but it's often not enough to meet the daily requirements, especially for seniors. Fatty fish such as salmon, mackerel, and sardines are excellent sources of vitamin D, as are egg yolks and fortified foods like milk, orange juice, and cereals. However, even with a diet rich in these foods, it can be difficult for seniors to get enough vitamin D from food alone. One reason is that vitamin D is fat-soluble, meaning it requires fat for proper absorption, and many seniors have trouble absorbing nutrients as efficiently as they once did due to age-related changes in digestion. Additionally, foods that are fortified with vitamin D may not contain enough of the vitamin to reach optimal levels. For seniors who may have limited access to these foods or struggle with appetite loss, food sources alone often fall short. For seniors, especially those over the age of 65, supplementation is often the best way to ensure they get sufficient vitamin D. This is especially important for individuals with specific medical conditions such as osteoporosis, chronic kidney disease, or malabsorption disorders, which can affect vitamin D metabolism. Additionally, seniors living in regions with limited sun exposure, especially during the winter months, are at a higher risk for vitamin D deficiency. Those who are homebound, have dark skin, or use sunscreen regularly may also find it more difficult to absorb vitamin D from sunlight, which is a natural source of the vitamin. In these cases, a supplement becomes essential to maintain healthy levels. Supplementation is also crucial for seniors who may have dietary restrictions, such as vegetarians or vegans, who might not consume the animal products needed for adequate vitamin D intake. Moreover, certain medications, such as steroids or diuretics, can interfere with the body's ability to absorb or utilize vitamin D, making supplementation even more critical. When it comes to vitamin D supplementation, it's important to choose a high-quality product that ensures proper absorption. Here are a few top recommendations. 1. Nature-made vitamin D3. This supplement provides 3,200 IU of vitamin D3 per soft gel and is backed by USP verification, ensuring it meets strict standards for purity and potency. Vitamin D3, cholecalciferol, is the preferred form of vitamin D for the body, as it is more easily absorbed and used compared to vitamin D2. 2. Nordic Naturals Vitamin D3. For those who prefer a liquid supplement, Nordic Naturals offers a great option with 1,000 IU per drop. This product uses olive oil as the carrier oil, which enhances the absorption of vitamin D3, making it an excellent choice for seniors who may have digestive issues. 3. Kirkland Signature Vitamin D3. Known for its high quality and affordability, Kirkland Signature provides 2,000 IU per soft gel. It's a great option for seniors who want a reliable, cost-effective vitamin D supplement. 4. Dr. Mercola Vitamin D3 with K2. This supplement pairs vitamin D3 with vitamin K2, which is important because vitamin K2 helps direct calcium to the bones, working synergistically with vitamin D to support bone and muscle health. This combo can be especially beneficial for seniors aiming to maintain strong bones and prevent falls. By choosing the right supplement, seniors can ensure that they meet their vitamin D needs, helping to preserve muscle health, prevent falls, and improve overall well-being. While supplements play an important role in filling nutritional gaps, they are just one piece of the puzzle when it comes to maintaining muscle health. An overall healthy lifestyle, including a well-balanced diet and regular physical activity, is crucial for supporting muscle function and strength. A nutrient-rich diet that includes lean proteins, whole grains, healthy fats, and fresh fruits and vegetables provides the essential building blocks for muscle repair and regeneration. Protein, in particular, is vital for muscle growth and recovery, and it's important for seniors to consume adequate amounts daily. Foods like chicken, fish, beans, and tofu are excellent sources of protein. In addition to diet, staying physically active is one of the most effective ways to preserve muscle mass. Strength training exercises, such as lightweight lifting or resistance band workouts, help stimulate muscle fibers, promoting growth and strength. Aerobic activities like walking, swimming, or cycling also play a significant role in improving overall fitness and muscle endurance. For seniors, it's important to incorporate a combination of both strength and cardiovascular exercise into their routine to maintain muscle function and mobility as they age. For the best results, it's essential to combine a balanced approach that includes not just supplementation, but also regular exercise and a nutrient-dense diet. Supplements like vitamin D or CoQ10 can help fill in the gaps where diet falls short, but they can't replace the benefits of a strong, active lifestyle. Engaging in consistent physical activity not only strengthens muscles but also helps improve bone density, balance, and coordination, reducing the risk of falls and injuries. Regular exercise also boosts metabolism, supports cardiovascular health, and enhances mood, all of which are vital for maintaining quality of life. Pairing exercise with a healthy, nutrient-dense diet ensures that muscles have the fuel they need to recover and thrive. Additionally, supplementation should be seen as a complement to these lifestyle habits, not a replacement. Incorporating these elements together, proper supplementation, a balanced diet, and regular physical activity creates a holistic approach that enhances muscle health, promotes longevity, and helps seniors maintain their independence and vitality for years to come. As we've discussed, muscle loss is a silent issue that many seniors face as they age. The good news is that with the right action, this decline can be slowed or even reversed. By addressing the root causes of muscle loss, such as vitamin deficiencies, lack of physical activity, and poor diet, you can take control of your muscle health and prevent the debilitating effects of sarcopenia. It's never too late to start, and even small changes can make a big difference in preserving muscle strength and function. Preserving your muscle strength is one of the most important factors in maintaining your independence and quality of life as you get older. When your muscles are strong, you're able to perform everyday tasks like walking, climbing stairs, carrying groceries, and even getting up from a chair with ease. The more proactive you are about maintaining muscle health, the longer you'll be able to enjoy an active, independent lifestyle without relying on others for basic tasks. Don't let muscle loss quietly take away your autonomy. Take action today to preserve your strength for the future. We encourage you to speak with your healthcare provider about your muscle health. Ask for blood tests to check for any vitamin deficiencies that could be contributing to muscle loss, such as vitamin D, B12, or magnesium. Your doctor can also provide personalized supplement recommendations based on your unique health needs. Taking this proactive approach will help you make informed decisions about how to support your muscle health moving forward. We'd love to hear from you. Have you noticed any changes in your muscle strength or mobility? Which supplements or lifestyle changes have worked for you? Share your experiences in the comments below. Your insights could help others who are on a similar journey to maintain muscle health as they age. Thank you so much for taking the time to watch this video and learn more about how to preserve muscle health as you age. We hope this information has been helpful and empowers you to take the next step toward better muscle strength and independence. If you found this video valuable, please give it a thumbs up. And don't forget to subscribe to our channel for more tips and advice on health and wellness for seniors. Like this video, comment below with your thoughts and experiences, and share it with others who could benefit from this information. We look forward to bringing you more content that will help you stay healthy, strong, and independent as you age.